Alex, my name's Elizabeth. I'm going to be your occupational therapist today. From reading your charts, I understand you had a surgery about 2 weeks ago on your wrist. You had an injury to your ulnar nerve. How are you feeling? How's everything going?
Well, Elizabeth, to be honest, I've been better. I've been having a lot of soreness in my hand and especially my wrist. To be honest, it's really uncomfortable.
Oh, I'm sorry to hear that. Yeah, pain and soreness after a surgery like this and after an injury like this are typical. So, can you tell me what do you know about occupational therapy?
Well, when the surgeon said I'd have to see a therapist, I was kind of freaked out because I didn't know what to expect. So I looked it up, and it sounds like you're just going to help me get back to where I can get working again.
Yeah, so that definitely might be part of it along the road. Right now, and in the next few weeks, we're going to look more at just safety precautions and then working towards getting you to be able to participate in activities that are meaningful to you again in a safe manner. So that's kind of our goal here in occupational therapy. So, just so you know, recovery with a nerve injury can be a lengthy process. So, it might require some patience on your part, and I know it's going to be frustrating, but we'll go over kind of what you can expect today, and we'll go over the common treatments and safety precautions and all of that. So, I want to go over the basic anatomy of your ulnar nerve and then talk about what they did in your surgery just to make sure that you walk away from here knowing what happened. So, your ulnar nerve is one of the main nerves in your arm. And we have our spinal cord, and up here at the base, kind of your skull and on your upper neck, is the cervical spinal cord. So, coming out of that, there's a network of nerves called the brachial plexus, and it kind of branches out. And one of the branches or cords, they're called, is the medial cord. And so, coming out of the medial cord is your ulnar nerve. And your ulnar nerve has nerve roots that originate in your C8 and T1 vertebrae of your spinal cord. So coming out of there, it kind of travels down near your armpit, down your arm, behind your elbow. There's this tiny bump on your elbow on the medial or inside called the medial epicondyle. So your ulnar nerve goes right under that, down through your forearm and into your wrist and hand. And it's got a big job. It's responsible for a lot of the fine motor movements in your hand. And then it provides sensation to your entire pinky and then the medial or the inside of your ring finger. So with ulnar nerve injuries, they can happen along anywhere along that path. The more common places for them to happen are either in your wrist, like occurred with you. You had your nerve cut at your wrist. Another common area is your elbow, and those regions are just not as protected by muscle tissue, so they're more prone to compression of the nerve or a direct blow to those places, or a cut or a wound like you experienced. So I did create this handout, and this is something you can take home with you, but it kind of just goes over the main symptoms that you can experience, and then it talks a little bit about the surgery. Yeah, so with these types of injuries, first, what they probably did, it's really important for them to go in there, take a look at where exactly the injury occurred and how severe it was, and that's going to determine what type of treatment you get. So, the really cool thing about our bodies is that nerves outside of your brain and spinal cord actually have the ability to regenerate and regrow. So if your injury isn't as severe, it's possible that a nerve can just heal by itself with therapy only. You had a pretty intense cut here, so you did need surgery. The good thing is they were able to do what's called an end-to-end nerve repair. And if you look in this picture, it's basically you can see the two ends of your cut nerve. They go in there and they suture it up. And so then the nerve kind of does its natural healing and regrowing process from there. Um, so do you know kind of about the healing process or what do you?
I would love to have that broken down because, like I mentioned, light at the end of the tunnel, softball, trying to get back as soon as possible. So, what's my road to recovery? What are
Yeah.
the milestones that I can start aiming for?
Yeah, so I'll kind of go over the timeline of recovery and what to expect. One thing I did want to mention before we get into that, I don't know if I really explained. the primary movements that your ulnar nerve are responsible for in your hand. So when you abduct your fingers, like spreading them apart and adducting, that's all the ulnar nerve. It's also responsible for some fine pinching and gripping movements. So these are some more symptoms you're going to experience: difficulty with pinching and gripping objects, just overall weakness and lack of coordination with your fingers. One other thing I wanted to mention, just so because we'll get into it here in the treatment, a common symptom that you might see is clawing, it's called, in your pinky and ring fingers. And kind of what happens is your pinky finger and your ring finger bend right up here. It's called the distal interphalangeal joint. So your fingers stay straight and then they bend right here. And that's due to paralysis or weakness in those small hand muscles. So, looking at our treatment timeline here, we're about 2 weeks post surgery. So, probably at our next session, what I'm going to do is create for you what's called a dorsal blocking splint. And so this is something that I'll custom make for you. And basically what it does is it puts your wrist and hand and fingers in an optimal position for promoting function. So your wrist is going to be slightly, this is called flexed. And then your metacarpal interphalangeal joint right here at your knuckles will also be slightly flexed, and your fingers are going to be extended or in a straight position.
Like this?
Yep. And so you'll wear that splint continuously. And basically, it's to prevent contracture of these distal phalangeal joints and prevent that clawing.
Yeah.
Yep. So then we'll also work on some active and passive range of motion exercises. Active range of motion is just you doing the exercises on your own, and passive is me assisting. And those will be ones you can take home and do yourself as well. Then in about 4 to 5 weeks, we'll alter that splint a little bit, make it a little less flexed at the wrist. At about 6 weeks, I'll create a new type of splint. It's called an MP blocking splint. And basically, it's more focused on that clawing prevention. So it'll be another splint that you kind of wear continuously. And then we'll continue with those range of motion exercises. I might give you some putty to bring home that you can kind of play with in your hand to work on strengthening those hand muscles. And then at about the 10 to 12 week period, we're going to start working on sensory re-education. And what that is just introducing your hand to different textures and temperatures and trying to get that sensation back that's been lost in your pinky and ring finger area. So just so you know, the growth rate of nerves is about 1 millimeter per day or about an inch per month. So it just kind of gives you an idea of how slow it can be. So it is going to be a lengthy recovery process. Some patients still see improvement for up to 5 years. So you'll just have to be patient, and you might not be able to do these things that you're hoping to do right away, but if you follow the protocol and everything, it should be a pretty good outcome for you. So, do you have any questions for me?
The only question I have is all of this has been so far out of my control. It's either the surgeon or you doing things. What can I do so that I can start getting better and then hopefully beat those timelines that you listed?
Yeah, I'm glad you asked that. So, like I kind of just said, just making sure to follow the direction from your doctor or therapist closely. So, if we tell you to wear the splint for a certain number of hours, just really sticking to those directions. Also, with the home exercises that we'll give you to take home, just really being diligent about getting those done at the suggested times. And then the other thing I just want you to keep a close eye on is your surgical area. Just watch for signs of infection, like any irregular redness or swelling. And there will be a little pain associated with it, but if it's something significant that you're thinking just doesn't seem right, I would suggest you contact your doctor, or you can call me as well.
Great.
Any other questions?
No, to be honest, coming into this, I was nervous, but coming out, I feel much better about the path to recovery. I really appreciate your time.
All right. Thanks so much. Take care, Alex.
Thanks. I'd shake your hand, but you know.